Hi, I'm Santiago Marquez. I'm the CEO of the Latin American Association, and it's an honor to be here with you. Happy New Year to those who are joining us, and I hope everybody's staying safe and healthy out there to the best of their abilities. Today we have a really special guest, somebody who I consider a friend and a leader, and who I think has been a real hero during this pandemic, Dr. Audrey Arona. And we'll get right to her in 1 second. But just to let everybody know, I am in the office. Our office is open. This is our headquarters here on Buford Highway in North Druid Hills. We continue to do most of the work that we're doing remotely, but we are serving people in person as we have been during the entire pandemic, just like our office in Lawrenceville and up in Dalton continue to do the same. We have had a large focus on rental assistance and food, providing food through food distribution, as well as working with our youth and our immigration department, and continuing to help Latinas open businesses and folks get trained in different areas through our economic empowerment department. So all of those services continue. We're here Monday through Friday, 8 a.m. to 5 p.m. So if you need us, give us a call. Schedule an appointment. We're here to serve you. Now to get to our topic today, which is critical, which is around vaccines and the virus. And by the way, feel free to ask a question on here on the chat, and we will go ahead and try to get to that question. So today's guest is Dr. Audrey Arona. And Dr. Arona, I'm going to let you tell us a little bit about yourself and your title and all that. But before we jump into that, why don't you, welcome to the show, number one, and why don't you give us a little bit of background on yourself? Welcome.
Sure. Thank you so much, and I'm so happy to be here and see all of you virtually. But happy that you asked me to be here today. Some really great, relevant, important information to share with you today. And I'm Audrey Arona. I'm the District Health Director for 3 counties in Georgia. That's Gwinnett, Newton, and Rockdale counties. Georgia is divided in 18 districts, and so I am Health Director over one of those districts, which incorporates 3 counties. As a background, I've been an OBGYN doctor for 30 years prior to accepting this role, and served in as a private provider for OBGYN in Lawrenceville for 20 years before now. Did my training at University of Cincinnati College of Medicine in Ohio. Did my residency for 4 years at Los Angeles County Hospital in Los Angeles, and am board certified in OB/GYN. Have 2 boys who are the pride of my life and my priorities, of course, and my hobby right now, I can't even remember because because it's been so long with all of this. But I feel blessed to be in this position to be able to make a difference to our community. So thank you.
Well, thank you, and it's always nice to really humanize folks that are in roles like yourself, right? Because sometimes we just tend to go right to the doctor piece and forget that you have a life and what, your background that's interesting and also inspirational, right? Especially to Latinas that are watching. I know I have a 17-year-old daughter who is, looking at maybe going to Johns Hopkins or maybe global health or medicine. And so I think it's very inspirational. Well, let's get down to the topic that we're discussing. So, if you'll tell us a little bit about your role in terms of Gwinnett, Newton, and Rockdale. What does that entail, and what has been your role throughout the virus?
Right, very good. Well, the health department, obviously, we have clinics where we serve a large share of the population, and we have various parts to our health departments. We inspect restaurants, we do emergency preparedness, we deliver health care services, child care services, immunizations, all of that. But since COVID began last year, we've been heavily involved in the testing of COVID, also giving educational guidance and isolation quarantine guidance to folks. And then also now the biggest phase is this vaccination effort. So it's been, we're happy to see this, and all of us can really see the end of that tunnel. It's taken a minute. summer, people would ask me, well, how long do you think we're going to be in this? And it was really hard to estimate. But now that we've got a vaccine in here, this, I believe, is the best tool in our tool belt to increase immunity into our community. And so I'm happy to provide an update for you.
Great. Yeah, well, thank you for that. And so tell us what is the state of COVID right now? I mean, I think that, we, at least certainly I read a lot and see a lot, watch a lot of news, and, everything looks very bleak in terms of what's happening with COVID. But, for in the metro area or in Georgia, where are we with COVID right now? Yes.
Yes, thank you. And let me share a few slides with you so you can really understand things. And there's a message for all of this too, which I hope people will take this to heart. Let me show the first of this. So can you see the slides there, Santiago?
I cannot. I'm not sure if the yes, now we can. Yes.
Okay, wonderful. So worldwide, our cases are over 92.5 million, almost 2 million deaths. In the United States, we're at over 23 million cases. These are confirmed cases, and over 384 deaths. Now, to give you just a little perspective, remember the Spanish flu in 1918 was the most deadly virus, a pandemic that we have ever experienced. And I just want to share with you that worldwide, at the end of the Spanish flu, confirmed cases were 500 million. Okay, so it kind of gives you a perspective where we are. The deaths were at 50 million worldwide, and a lot of those were a lot younger children. The United States during the Spanish flu actually had 675,000 deaths. So you can see we're really half of where we were almost, from the Spanish flu. So that people, I think, can relate, not to the Spanish flu because that was so long ago, but at least to understand that this is really, challenging. And then also the deaths are not something to dismiss without a doubt. In Georgia, what I've done is provided confirmed and antigen positive cases. Antigen positive are the rapid tests that we're doing, not the antibody tests. And so when you do a rapid test and it's positive, we don't send a confirmed test to confirm it anymore because the antigen tests are considered real cases. So I thought in order to really give you an accurate picture of what this looks like, both confirmed and antigen cases, over 782,000 cases just in the state of Georgia, and of course near 11,000 deaths. For Gwinnett County, we currently sit with confirmed and antigen cases at 68,000. Our deaths are near 600. And of course, our hospitalizations are up there too. So these numbers are all from way back March. So this does not mean that we have 68,000 people in Gwinnett County that are sick right now. But to look at the transmission rate of the virus within our communities, like how much COVID are we experiencing right now? On the left hand corner here, the 14-day case rate and the 14-day positivity is what we look at to try to figure out how much COVID is really truly in our community now as opposed to before. So for Georgia, the current 14-day case rate is 794 cases per 100,000 population. And just to give you a perspective on what the holidays have done to our numbers, 220 cases per 100,000 was where we were on November 9. So you can see we're 4 times that rate. The 14-day positivity is currently in Georgia almost 20%. And back in November 9, it was 7.2%. So that's, again, 3 times higher. Gwinnett County currently is at 959 cases per 100,000. And these are confirmed cases, not confirmed and antigen cases, right? But for sake of comparison, in November 9, our rate was 199. So that, again, is near 5 times as high for Gwinnett as we were in early November. And our positivity is now 25, almost 25%. That's 1 out of 4 people that we test are positive. whereas in November 9, it was 6.9%. So really what this is telling you is that, we really had increased numbers and bad things happening to our numbers after the holidays. Let me show you the next slide. So this is the United States, and you can see this is in April and last year. This is over the summer months. And then now you can see in our country the high numbers that we're experiencing now. We're seeing numbers that we've never seen before. This next slide is one that shows you in Georgia. This is Georgia. Again, this is April. And remember, we weren't testing very many people here. We were only testing ill people because, if you recall, we were having trouble with test kits. We couldn't get enough test kits for everyone. This is in the summertime when our cases started to really climb, and now you can see it's much higher in Georgia. So for our district in Gwinnett County, our district incorporates those 3 counties I mentioned. However, Gwinnett County is the largest and represents the most data here. But you can see this top graph. These are our cases for Gwinnett, Newton, and Rockdale County. And you can see our numbers are higher than they were even in the summertime. This is the second graph is a report of our deaths. And you can really see that our death rate has really not changed. Our death rate has really been about the same. And what that means is that as we get more cases, we're going to have more deaths. But the good news is that, we've really done a good job of trying to protect people who are most at risk for this. And then on the outbreaks on the very bottom one, this is to tell you these are outbreaks like long-term care facilities, assisted living, that type of thing. And you can see that our numbers being as high as they are not outbreak driven. That means our numbers are really in the community and not there. So the last slide I want to show you is where we are. So the CDC and the Department of Public Health and Operation Warp Speed, of course, all came together and tried to develop phases of who should get vaccinated first. So we are currently in phase 1A, and phase 1A includes, the first responders. That's emergency medical services, the paramedics and EMTs, the fire, police. It also includes frontline healthcare workers. That's doctors and nurses and clinics and, school clinics, all of that. And then, of course, adults 65 and older and their caregivers. And so this is currently where we are. The governor in Georgia added fire and police and 65 and older right before New Year's. And that added a really large amount of people. So we had hoped to get to phase 1B by the end of January, but I think it's going to be into February before we see that, hopefully by mid-February. So phase 1B will be next. And essentially, this is our critical workforce, which are people that are really important, like you, Santiago, to make sure that, our functions in our society are good and can continue without any pause. And this includes, our national security. It includes our educational staff in schools, teachers, of course, court employees, attorneys, lawyers, air traffic controller, our food, all the way from farmers to grocery workers, corrections employees, postal service, public transport, all of that. Then when we get to phase 1C, this will be people under the age of 64 with medical conditions. Phase 2 will be some of our congregate setting like homeless shelters and group homes, jail populations, prisons, detention centers, that type of thing. And then we get to the general population. So even last few weeks ago, you would have heard that there are 4 phases, but this was revised recently down to 3 phases, combining some of what was in phase 2 up to higher phases. So let me stop sharing this with you right now, and I will, whoops. There we go. So a little bit more about the vaccine. So we are currently in phase 1A. There are 2 million people, roughly 1.8 to 2 million people in Georgia that qualify under phase 1A. So you can see it's going to take a minute for us to get all of these people vaccinated. we expect to be here. Hopefully we'll get to there. Now, CVS and Walgreens are vaccinating long-term care facilities and assisted living, their residents and their staff. And so they're working diligently on that. Some of the local pharmacies, other medical providers now are getting or have received vaccine. So it's not going to be all on the health department to disseminate this vaccine and get it administered. But the other chain pharmacies like Kroger, Publix, Ingles, and even Walmart, we're hoping by next week we'll have vaccine to help us with this task as well. Right now, this is all appointment based. And so I gave Aisha our website. So in order to access an appointment, you have to go on the website. And it's not a difficult process to enroll. It's just our supply of vaccine right now is the limited resource. We have far more demand, much more demand than we do vaccine supply. And so I'm just asking everyone to be patient as we roll out this vaccine. As we get vaccine from the state, we schedule appointments. So we cannot open appointments until we receive vaccine. And remember, this is a 2-dose vaccine. So we're already starting to give second doses because people are not fully immunized until 1 to 2 weeks after their second dose. So and the public needs to understand there's a lot of challenges with this vaccine. First of all, it's very fragile and it has to be handled very carefully. You can't shake it. When you mix it, you have to be very careful how you mix it, how you draw it up, how long it can stay at room temperature, how long it can stay out of the freezer, how long it needs to stay in the refrigerator before then you use it at room temperature, and how long once you puncture a vial, how long you can use it before it's ineffective. So that, plus the fact that we have to social distance when we're seeing patients, and then also we have to watch patients for 15 to 20 minutes after we give the vaccine. So there's some real challenges in the mass vaccination effort. So that's why it's going to take some time to get this vaccine into the arms of people. So because of what I shared with you in terms of our numbers, it is critical that everyone really follow the prevention measures about COVID and limit the spread right now until we can use this very essential vaccine tool to provide more immunity to our community. We need everyone to follow those rules. Wash your hands, wear a mask, social distance, because at the rate of spread right now, our numbers are so out of control. And the real problem with that is our hospitals are overloaded. They're overcrowded. Patients are in the hallways. We already have a field hospital. Grady Hospital is full. And the surge capacity plans at all of our hospitals are almost at capacity. We opened the World Congress Center, and so we have extra beds there, but 2/3 of those are gone already. And so what happens when you run out of medical beds? What happens if you run out of hospital space? And that's when you start having to make decisions about care, who gets care and who doesn't. And so we don't want to be there. We absolutely have to control these numbers and get them down to where we were in November. So I'm just making a plea to the community, to all of you, to really, really try to adhere to these messages and do your part to stop the transmission of this virus while we work so hard and diligently to get this vaccine into the arms of people. The other thing that I would say is every day our vaccine, as we get more vaccines, we increase capacity to have more and more vaccines every week. So soon we will be opening, not this next week, but hopefully a week from Saturday, we'll be opening a very large, centrally located vaccination place in Norcross where people can come to get their vaccines. It's on the bus route, so we realize people have transportation issues. We have plenty of staff that speak other languages. There is absolutely no documentation needed. This vaccine is open to any person in Georgia qualifies for phase 1A currently. And then when we roll it open, we'll get more and more that way. So I guess with that, I'll maybe stop and see if you have any questions, Santiago.
This is great. This is makes my job really easy. And thank you for that information. I do have a couple of questions. So just to back up a little bit, number one, what is the death rate? I know you said it has stayed the same, but for those of us that don't know, and certainly we're seeing the number of deaths increase, but that's because we're seeing the number of cases increase. But what is the rate?
Well, our case fatality rate in Gwinnett County currently sits at about 1%.
1%.
1%. So you might ask, how do I get the vaccine if it's got a 99% survivability rate, right? Why not just get COVID and then get natural immunity to it, right? And the answer to that is, first of all, it's very deadly to a certain segment of our population that has medical conditions, so we need to protect them. But more importantly, we know now that this virus, even in young people, can cause terrible problems in their body systems down the road. We've seen young people develop pulmonary or lung problems and heart problems, and just, you know, some people never get their smell back right. Even brain issues and stuff. So we really, this virus is, even though it may not be as deadly to certain groups of our population, there's long-lasting effects from this virus that can damage our health and put us at, you know, more susceptibility for other things in the future. So the vaccine will prevent all that, not 100%, but over 90% for sure.
Thank you for that. And so also, there's really no telling what impact the virus would have on your body, right? Like, so, you know, you may think you're perfectly healthy and you may not be aware of some conditions you have, right? So is that true? That's
very true. And we do know that some people who have chronic medical conditions, and even in children, that this virus really likes to preferentially hurt them. And so, but we have seen cases where kids have absolutely, and even young adults have absolutely no medical problems whatsoever, but they have a very hard time recovering from this virus, and they have long-lasting issues afterwards. So again, it's not safe for really anyone, and that's why I'm saying the vaccine is probably the best tool to provide as much immunity for this as we can.
So right now we're in phase 1A, and you just stated that the demand, you know, is far greater than the supply. So, you know, it's appointment based only. So as 1A, how long do you think, do you have any idea of how long we're going to be in 1A, number one? And then number two, while we're waiting for the vaccine for folks that are down, you know, the ladder, you know, I know that we talked about continuing to do certain things, but what should we be doing, you know, since the numbers are skyrocketing while we're waiting to get vaccinated?
Right. Great question. And I'm not sure when we'll get out of phase 1A, because again, we have 1.8 million Georgians that fall in that category. So I'm hoping by mid-February we'll be in phase 1B. And that's, of course, very dependent on the amount of vaccine that Georgia gets. Okay. My advice to the population is anticipate every single person around you, your best friend, your family members, everyone. Just assume they have COVID. When someone sneezes in a grocery store, everybody just backs away, right? And just wants to get out of the way. Well, act as if every single person around you, including your family, is positive, because that puts you on high alert and you're more likely to stay away. You can still do things. You can still work. You can still congregate. You can have dinner. You can do things, but just make it socially distanced. Just stay that far away, so that if your best friend says to you, hey, I had COVID yesterday and we were together, you can say, yes, but we were not within 6 feet. And we didn't stay, you know, we were not 15 minutes or more within 6 feet of each other. And now you're not a contact, so you don't have to worry. So again, I think that's the best thing, is just to assume every single person around you. This virus is very evil. And this virus is infectious 2 days prior to any symptom, before anyone ever knows it. And that's how this is spreading into such a large pandemic in large numbers, because people get together for holidays and they have the New Year's and parties and things. And people are so tired of being away from each other. And so they really want to celebrate being with each other. And that's the problem, because you don't even know you have it for 2 days. And now you have to tell everyone you are around that you've exposed them. So again, my request is that everybody just treat everyone, even grocery store, if you're at the market, you're getting gas, you're wherever you are, just assume the person next to you has COVID, and you will be okay if you act that way.
Don't let your guard down, in other words. And okay, so quick question. Let's say I live in Gwinnett County, and which is true, and I am not able to get my father an appointment, excuse me, for the vaccine, because they go so quickly. Am I able to try to find an appointment somewhere in another county that may not have as much demand, even if I have to drive 45 minutes, an hour, 2 hours? Is that okay? Will that work? Or is it only for the residents of that county? Do they have to go to that Department of Health?
Well, great question. And the answer to that is always check. If you're going to go up to Hall County Health Department, call them first and make sure that you can. My guess is that if you're able to make an appointment, since this is all over appointments, all appointment based, you probably wouldn't be able to make an appointment if they had that rule. Some counties were doing that initially, and I know that the state directive right now is to try not to do that. We do limit it to state of Georgia residents, because every state gets vaccine for their own population. But here in Gwinnett County, for instance, no matter where you live in the state of Georgia, if you can get an appointment with our health department, we will honor that appointment. But you have to fit in the phase in which we are vaccinating. So we won't accept, even if you're able to make an appointment, if you show up and you don't fit in phase 1A, we will not give you the vaccine.
Understood. Well, and that might be helpful for a lot of people. I know that I've tried to help my mother and my father, and thank goodness we've been able to get them appointments and get them vaccinated. But in the case of my father, he got vaccinated up in Cherokee County, right? And it was a great process, but we're very grateful for that. But that's the way it worked out. I guess you can't really control. Each Department of Health is getting different, because we've heard some things about there's a difference between the Pfizer and Moderna, and it doesn't really, does it matter? Or, in some cases, I had one staff person who told me that her doctor told her that she should get the Pfizer, vaccination, because it has less preservatives. I don't think you're going to be able to get a choice here, right?
Well, first of all, both types, Pfizer and Moderna, are mRNA vaccines. So, and I'd like to address two common questions about those. Number one, what are the ingredients? They're both mRNA. They both have polyethylene glycol, which some people are very allergic to. But usually if you're allergic to that, you know it. So if you're allergic to polyethylene glycol, or PEG, we call it PEG, then you wouldn't want to get this vaccine. But the other things are just polysaccharides. There's cholesterol. There's a little sugar in there. There's not a lot, but just lipids and salts and sugars, right? Just to bind the vaccine, right? The other question I get is, this was developed so rapidly, how can I trust it? Okay. And so to address that, I want to tell you that this vaccine actually was based on technology that our scientists were working on already. Before there was ever even a first case in the United States, the gene for this virus was sequenced, and that had early on in January. And so the scientists were already working on a vaccine in January based on the mRNA technology before that ever came. Now, this is not a live vaccine. So, and it's not a killed vaccine there. You have to take the virus and kill it. And you don't have to grab the virus and grow it in culture to produce the vaccine. And that takes a lot of time and it's very complicated. And since this is not a live vaccine or based on a killed virus, you don't have to take that step. So that's, again, an added advantage in terms of time. And again, this is technology that they've worked on mRNA technology for a long time, and the rapid sequencing of the virus plus the technology, it didn't take them that long to develop this vaccine, which is awesome. So that, I think, is a part in some people's minds because they worry about the rapid development. Is it safe? Both vaccines have, Moderna and Pfizer have really much the same side effect panel. Usually just a little local redness, swelling where the shot is, maybe a little mild achiness, maybe a little low-grade fever, headache. That's very short-lived. And so it's really not a difficult vaccine to take. I have had both doses now. The second dose was just a little tougher. It hurt just a little bit more in my arm later that day. There are some people, and I got it because I'm vaccinating people every week myself with my team. And so that's why I got the vaccine. But it's really not that difficult to take. It's not near like some of our other vaccines, like the tetanus shot. That one's really painful. It's nothing like that.
Got it. Got it. Thank you. And one last question, because I know that time is slipping away from us, but this is such an important topic. For those that are watching, if you want to put a question here in the chat, we're happy to answer. And we have one. Oh, we just have a comment. Very informative. Thank you for your expertise. But feel free to ask a question if you've got one. Doctor, can you stay with us like 5 more minutes? Is that okay? I know that
I will tell your folks that there's been some questions about what do you do if you've had COVID recently? Do you still qualify for the vaccine? And if you're sick with COVID, you don't want to get this vaccine. If you're sick from anything, including COVID, if you have the flu or a sinus infection or anything, we don't give ill people the vaccine or any vaccine for that matter. Okay. If you've had COVID-19 in the last 90 days, 3 months, you don't need the vaccine until that 90-day period is over, right? Because we know the CDC tells us that you really have this safe immunity, natural immunity for 3 months after you're positive for COVID. So allow your vaccine that you would get to somebody else and prioritize it who hasn't had COVID, right? Now, if you get COVID and you're very sick from COVID and you end up in the hospital and you get the remdesivir or the monoclonal antibodies or convalescent plasma or any kind of infusion related to treatment of COVID, you have to wait 90 days before you get the vaccine. And the other more important thing is we don't want you to have had another vaccine within 14 days of when we give you the COVID vaccine. That's true for any vaccines. We really, unless they're meant to be together, like sometimes your children get more than one vaccine at a time. And that's okay. Yes. But with this vaccine, we don't want you to have any other vaccine for 14 days when you
Got it. Now, question on, and we have a question here, is testing as widely available as before?
Yes. In fact, it's more available in our community. There's several places that offer testing now, which the health department is very grateful for because it's taken all of us, all hands on deck to do this vaccination event. Our health department still is providing testing, but we're trying to prioritize it to sick individuals and also individuals who need a test because they're contact day 6 and need a test to get off of quarantine. So we're trying to do that. So we are providing still some testing, but since there's so much testing available in our community, we're focusing our efforts on vaccination.
So folks that are feeling, that aren't feeling well, but maybe are hesitant now to go to the hospital or, in an emergency, because I know certainly we keep hearing that, and I think obviously this is true, right? The hospitals, correct me if I'm wrong, the hospitals are overwhelmed and their capacity, they've exceeded their capacity. So what happens with folks that are having symptoms, other symptoms, maybe they feel like they're having a heart attack or they don't feel well and they're just very hesitant to go to, call the ambulance or go to the emergency room or what do we do in these cases, right? What's your advice for folks like that?
Well, and you'll hear this throughout the counties that all of our hospitals are on diversion status, right? A lot of folks think that that means that you can't go to the ER if something happens. What that means is that other counties will not bring emergency folks into our county hospitals. Okay, so that doesn't mean that our emergency rooms in our local hospitals will not take you. They do. They do. They just, if you live in Duluth, and sometimes our hospitals are.
I think you might have frozen there, Dr. Arona. You still with us? Okay. I think we might have Dr. Arona actually frozen. Let's give her a minute to see if she unfreezes, thaws out. But just to recap what we have talked about here today with Dr. Arona, this very important topic is that right now we're in phase 1A of the vaccine. 1A is for folks that are 65 years and older or their caregivers. There are appointments. You have to go on an appointment. I believe every Department of Health has rolled these out. Oh, okay. So she lost power. She'll be coming right back on. So just to do again, continue with the recap. She suggests that you call first, but it may be that if you're able to book an appointment, you don't have to go to the Department of Health in the county that you live in. Certainly experienced this on a personal level where, today my father was vaccinated in Cherokee County and we live in Gwinnett County. And as the appointments were becoming available in Gwinnett County, they were just being eaten up, right? The demand is so high. So the recommendation is to make sure that you call first or make sure that, so you don't have to waste a trip, but definitely appointment only. It looks like, according to Dr. Arona, that we're going to be in this phase. She's not sure, but we'll be here in this phase until mid-February, I think, and that we hopefully will start rolling out phase 1B here, shortly after that. It looks like the phases have been expanded in terms of folks that can be included in those phases. I have had questions from our staff here, from folks that are helping clients and seeing clients in person. Where do we fit into that category? And it looks like if you're an educator or, a delivery person are considered essential or crucial, you may fit into that 1B category. So, that's something to keep an eye on. I think that as we are not able to get Dr. Arona back, she covered a lot of topics today. So we have to keep mitigating, continue to social distance, continue to wear a mask, washing your hands, stay, make sure that you're keeping yourself safe by assuming that all those around you have the virus, right? And Dr. Arona's back. Perfect. So I was just giving a little recap. So the last question, because I know we've kept you beyond time, but one thing that we've been hearing about is the different strains of the virus. Do you have any information on that? Because I know that even threw me for a loop, right? What can you tell us about that?
Yeah, so
we may have lost her again, unfortunately. Maybe she can text me the answer. Hang tight. Because I think this is an important one. At least for me it is. On the different strains. And I know that it made me a little bit nervous, especially as the vaccines were rolling out, information on different strains. Let's see if we can get her back. We'll hang tight. But just to continue to recap, we need to assume that everybody around us has the virus, and it's the best thing that we can do for now. We know we live in Georgia. Georgia's been a state that's been open back, since May, and continues to be open. So I think that I'm at work right now, but everywhere I go, I have to wear my mask unless I'm in my office. And we are trying to stagger employees in and make sure that we're keeping folks away. So she's responded. Variant is problem more than we know. It's contagious, but not more deadly. And the vaccine we have will cover the variant also. So it looks like in terms of the strains that we know, we probably have different variants than we know of, but it's not more deadly. So that's good news. And it looks like right now, at least, the vaccine covers the variants. And that came right from Dr. Arona. So at this point, I think what we will do is we will conclude. Thank you for being with us. I hope that you found this to be, there she is, she's back. Okay, so tell us about the strains. No worries.
Yes, no the variant is, I think it's more around us than we know. It's been recognized here in Georgia, at least one case now, maybe more. It is more contagious and more infectious, however, not more deadly. And the vaccine that we have will cover that variant as well as others. So we're good in that regard.
That's great news, at least that we know that the vaccine covers it. Well, Dr. Arona, you've been very generous with your time. We know that you've got a lot of important work to do. This is important also, but I can't thank you enough. And, you know, any last words for folks?
Other than just help us with these measures and help us get our numbers down. If anyone has any problems or needs advice or guidance or anything, I gave Aixa my email. Please email me. You have my cell phone number, Santiago. So if you need me, you know, just reach out to me. Anyone can have that cell phone number too. I will help everybody. We have a really, really good process in place, and it's streamlined. So when it's your time to get the vaccine, it's real seamless. It's not hard. You don't wait very long. We've got the whole process set up. So trust us for that. It's very safe. You don't have to worry about getting COVID when you come in for the vaccine. We follow all those measures, and we'll make sure you get your second dose when we can get it. And just trust us. We'll do a really good job for you.
Well, thank you. We do. And I think for me anyway, it speaks volumes that you yourself have been vaccinated, right? And, you know, I think I always like to see our leaders go first, you know, in that case, because it puts at ease any questions that we may have. So again, Dr. Arona, thank you so much for everything. And again, to those watching, remember, we're here to help and serve. Give us a call, make an appointment, you know, come by. You know, we're happy to help you in any way that we can. Thank you, guys, and stay safe. Thank you, Dr. Arona.
Thank you. You're so welcome. Wonderful to see you.